Hi, my name is Kristen Burke, and I'm going to be doing case study number 1. Mr. Wendell Sable, correct?
Yes.
Hi, my name is Kristen Burke. I'm one of the nurse practitioner students.
Nice to meet you.
Nice to meet you too. Now, do you go by Wendell, or do you prefer to go by something else?
Everybody calls me Joe.
Everybody calls you Joe? Okay, well then if you don't mind, I will call you Joe as well.
Absolutely.
Okay, excellent. Today, I know you've come to me, from my office for the first time. The little bit I know, sounds like you've been having some trouble at home with sleeping, some things like that. So we're going to this will probably take about 30 minutes or so, maybe a little less, maybe a little more. We're just going to talk about what's going on with you, what's happening, and then see if we can come up with a plan, and then hopefully a time to meet after to see if we can figure something out, see if we can get you back on the right track.
Okay.
Okay? So, in your own words, what brings you here today? What's going on?
Well, I guess, for lack of a better term, I'm just, lately, I'm worrying about everything.
You've been worrying about everything.
Everything's bothering me. I'm just feeling like my mind's racing. I'm always stressing out about things, thinking about things. My wife actually suggested that I come talk to someone because she's kind of sick of hearing me worrying about everything.
Okay.
So.
All right. So you think that she wants to see you get better as well, or figure out
Yes.
at least what's going on?
Yeah.
What's upsetting you so much? What's
Yeah.
throwing you off? Okay. All right. Sounds good. So just a little bit about what's going on. You said you feel like, your mind's constantly racing. Mm-hmm. You're worrying about things all the time. Did you, when this began, when this started, any ideas?
Truthfully, it's been going on for a little while. I'm gonna say 7-8 months now, and I thought it was just a bad spell.
Okay.
But it hasn't seemed to stop.
Okay. All right, so you think it started probably about last summer sometime? You said about 7-8 months? About last summer? Okay. How is it affecting your life now? You said obviously it's straining on your, your relationship with your life a little bit. Is there anything else that it's interrupting? Any other parts of your life?
Well, I'm having trouble sleeping. I'm doing a lot of tossing and turning at night because I just can't seem to shut my mind off.
Okay.
I'm always thinking there's a million different things going on.
Okay.
So, I guess I'm more fatigued, and so I'm not getting a lot done that I need to get done, which probably makes me worry more.
Yeah, absolutely.
Absolutely. I think it's affecting my work productivity.
Okay.
Getting stuff done around the house.
Okay. Now, do you feel like it's been getting worse over these last 8 months? Do you feel it's been about the same these last 8 months?
I would say the last couple months, I think it's escalated. It's gotten a little worse.
Okay,
yeah.
So you feel like you said, it's escalating. It's starting to get worse.
Yeah.
Okay. Have you ever, outside of these 8 months, have you ever felt like this before? Have you ever had any similar episodes in the past?
No, I haven't. I've always been pretty level-headed. A little bit of a workaholic.
Okay.
Get a lot done.
Okay. All right. So you've never felt like you said, this anxiousness, like that you're not. You said that you're not as productive as you like to be. Mm-hmm. That kind of thing. This has never happened in the past.
No.
Okay. Because we have the ability to help, we like to ask everybody just to make sure that you feel safe at home.
I do.
You feel safe in your relationships. And that, do you have any thoughts about hurting or killing yourself or others?
No.
Nope. So those kinds of thoughts have never crossed your mind.
No.
Okay. All right. Good. All right. Just kind of almost go over, Joe mentally head to toe in this next set of questions. Okay. Just talk a little bit about your mood. Ever in this last 8 months, or even more in the last 3 or so, any feelings of sad, depressed, irritable?
Yeah, definitely irritable. I'm definitely more irritable lately than I have been.
Okay.
Sad. Some days. I guess depressed. Like I said, I feel fatigued.
Okay.
But I also maybe, I know I want to do something, but I can't bring myself to do it.
Okay. Like you said, because of the fatigue, or maybe something else going on.
Yeah.
Okay. Any thoughts that you're seeing or hearing things that aren't there? Hearing voices?
No voices. I mean... There's times when I feel, I guess, hyper alert and easily startled.
Okay. Okay. All right. Easily startled. Okay. Do you feel like when you start to worry, you feel like it's difficult to control it?
Yeah, it's been getting more and more difficult to control it.
More and more difficult.
Usually I can just kind of brush things off or fight through things, but lately, it whatever's going on seems to be winning.
Seems to be winning. Gotcha. Absolutely. Do you find that there are any places, situations, objects, anything like that you try to avoid because you know that it may make these feelings worse?
Crowds, crowded supermarket, crowded restaurant or diner. I'm just really not comfortable in. So I actually haven't been socializing that much, I guess, the last 3 months either.
Okay. Now, just as a note, panic attacks, things that kind of come on you suddenly and you feel like they're irrational, like there's no real reason for them. Do you feel like that this has happened to you at all in these last 8 months?
Yeah, especially... in the crowded places, I mean, I'll get, it's like a feeling of claustrophobia, I guess. Mm-hmm. And I'm looking over my shoulder and my heart starts racing and I'm feeling nauseous and I leave.
And you leave. Okay. So you take yourself out of those situations when that starts to happen. Yeah. Okay. Well, I guess it's good that you have the wherewithal, you can think about what's happening around you and recognize that the situation may be what's causing this. Let me put myself in a different situation.
Yeah.
Okay. Do you feel like you have any physical acts you have to do? Like you feel like a compulsion, you have to do something so that it would help you avoid any stressors or any of those kinds of things?
Well, I mean, I make my rounds around the house, at night and make sure everything's secure. I have to do that every night.
Have to do those kinds of things. All right. Now, some of these next questions make it a little bit difficult, but we feel that, or I feel, that as part of this, us getting to know each other and to see if we can get to the root of what's going on, that we need to talk about them. Okay? Talking a little bit about some traumatic experiences. What would be the worst thing that has ever happened to you?
The worst thing that has ever happened to me?
Yeah. Does anything stick out in your mind?
Yeah, I guess when I was over in Afghanistan and we lost 5 U.S. soldiers, 5 soldiers to an IED one night.
Okay. Have you ever had an experience, say when you were in Afghanistan or any other time in your life, where you felt that your life was in danger?
Every day that I was there.
Every day is there. Like I said, some of these may be difficult to answer or may even sound silly to you. Another difficult question: have you ever been physically, emotionally, or sexually abused in any way? You personally?
No.
No. Okay. Now, excuse me. We all have trouble sometimes remembering things from time to time. But do you feel like you ever lose time, or you have evidence that you participated in some kind of event, but you don't even remember being there?
Well, yeah, I mean, as far as, I'll evidently when I do sleep, I don't know if this is what you're looking for, but, evidently I'll be sleepwalking and, I'll wake up in the morning and things are rearranged. Like I've taken all of the toilet paper out of the bathroom and restacked it in the closet, rearranged things in the kitchen cabinets, and I'll wake up the next day and can't find anything, and then I see things are rearranged, and I'm like, my wife will say, "Yeah, I heard you up walking around last night." I don't remember anything.
But you don't remember it. Okay. The next thing would be called like somatic concerns. So are there any physical symptoms? Do you feel like you feel sick more than normal, or that you worry about your health more than other people would?
Yeah, I guess lately I'm worrying about my health. I mean, because I'm starting to feel like for lack of a better term, I'm broken.
Okay.
I mean, I can see that I'm having some issues, with anxiety, I guess, and like short-term memory. I can't seem to remember stuff that people tell me.
Okay.
Concentrating seems to be a problem too. And having problems like actually sitting and reading something in a magazine or on a computer screen or watching an entire half-hour TV show.
Okay.
I have trouble concentrating on it.
I feel like anybody would be concerned if they had those difficulties. So that is absolutely a valid concern. Any physical symptoms to go along with this? Nausea, vomiting, diarrhea, any of those kinds of things?
Nausea and diarrhea usually goes along with the heart racing.
And your heart racing.
Yeah.
Okay. All right. How often do you experience those symptoms?
Oh, 2-3. It's getting to be 2 or 3 times a week, I think.
2 to 3 a week? Okay. All right. In terms of eating, drinking, food, water, the things the necessities we need to stay alive every day. Do you feel like you worry about how you look? Do you find yourself not eating for those kinds of purposes, or do you find yourself not eating for any reason in particular, or is your appetite normal?
It sounds silly, but it's like I forget to eat.
You forget to eat. Okay.
I get worried about something or distracted about something, and by the end of the day, my wife will ask me, have you had anything to eat today? And I'll be like, something I haven't.
Okay. Okay. And you feel like it, and it's not necessarily, just want to make sure I'm clear on this, it's not necessarily because you feel like you're overweight, you're underweight, those kinds of things, but you feel like you forget to eat because you're so busy worrying about something else.
Yeah. Sounds weird, but that's what's happening, and I can't be that hungry.
Yeah.
But, yeah, it's like I forget to eat.
Okay. You had mentioned sleeping, that you were having trouble sleeping earlier, tossing and turning, those kinds of things. Has that also been going on the whole 8 months?
It's gotten worse, but I would say it's been going on at least a little bit for the 8 months, and then, like I said, the last couple months or so, I think it's gotten worse.
Okay. And now one of the other questions we asked is if anybody around you is sleeping, whether it be your wife or anybody else in the house, have they noticed that you've been doing things in your sleep? So you mentioned that you get up and move around the house, and your wife has noticed that.
Yeah.
Has she noticed any night terrors, nightmares, that you're dreaming more than normal? Those kinds of things?
She's woken me up a few times saying that I was like screaming in my sleep.
Okay. Right. Alrighty. And now, how often does that happen?
It's not all the time. Maybe once a week, once every couple of weeks.
Okay. And how about, do you drink alcohol at all?
I do.
You do? Okay.
Yeah.
Do you find that you've been drinking more than normal?
I would say, yeah. The past, 2 or 3 months, I always like to have a drink at night before bed, but I think I've been drinking several drinks before bed.
Okay. So by several, you mean 2, 3, 4?
Yeah. I would say, on bad nights, 3 or 4.
Okay. Alrighty. Do you use any kind of tobacco products?
I use chewing tobacco.
Chewing tobacco? Okay. And do you any kind of illicit drugs? Marijuana, cocaine, heroin, any of those types of things? Nope. Okay. All right. Very good. So that's kind of, like I said, the Joe head to toe, sort of what's been going on, what you've been feeling. Okay. This next couple of questions are going to be about your medical history in the past. Like I said, again, just to try to get the whole picture, so we get to know you on all levels. So that way we can better understand all of you, and hopefully we can figure out what's going on. Okay. So past medical history. Do you have any chronic medical conditions? High blood pressure, diabetes, asthma, those types of things?
Yeah, I have high blood pressure.
High blood pressure? Okay. Do you take medications for that?
Yes, I do.
Okay. Do you have any feelings about the fact that you have high blood pressure? Does that make you feel
no, because I think it runs in the family. My father has it.
Okay.
And he takes medication for it.
And he takes, okay. Surgical history. Have you ever had any surgical procedures done?
Yeah, I had a discectomy or a laminectomy, discectomy, whatever they're calling it now. On my lumbar spine, back in 92, I think it was.
Okay.
I blew out a disc playing baseball.
Okay.
And let's see, I had arthroscopic surgery on my knee. That was earlier. That was back in the late 80s. And then I had torn rotator cuff in my shoulder. That was probably 5 or 6 years ago. They had to go in and repair that.
Okay. Any history of seizures or any head injuries where you lost consciousness at all?
No.
No? Okay. All right. Now, you said you take medication for the high blood pressure. Do you take any other kind of over-the-counter medications, vitamins, anything like that?
Well, I take a multivitamin, and I've been taking ibuprofen, about 600 twice a day.
Okay.
And that's because I've got some torn meniscus in my knee and torn labrum in my shoulder. So.
Okay. Alrighty. Is that something they think they need to fix, or?
Eventually, yeah.
Eventually? Okay. All right. Any allergies to medications?
Yeah, I'm allergic to sulfur drugs.
Sulfur? Okay. Right. Any other allergies other than medications?
Bees.
And bees. All right, so sulfa and bees, huh?
Mm-hmm.
All right. A few questions about your family. You said you mentioned your father has high blood pressure.
Mm-hmm.
Has anybody in your family have a history of like nervousness or nervous breakdowns, depression, mania, anything like that?
My mother's had problems with depression.
Okay.
And I believe she's currently on antidepressants. She has been for a few years now.
Okay. Any problems in in your immediate family with alcoholism, drug addiction?
Not that I know.
No. Anybody with suicidal ideations or thoughts or actual attempts at committing suicide?
Apparently, I don't know all the details because my family doesn't share a lot of information about stuff like this. But apparently, my aunt, my father's sister, younger sister, attempted suicide at one point.
Okay.
When she was a younger adult, when she was in her 20s.
Okay. All right. Now, some of these, again, another set of questions that may sound, slightly out of place, but again, are a part of, getting to know the whole Joe. It's like questions about your developmental history. So when your mother had you and she was pregnant, delivery, were there any problems there during her pregnancy?
Yeah, she had, I guess she had gestational diabetes and some other problems, and I was actually induced slightly early.
Okay. Slightly early or premature?
Well, I guess prematurely.
Prematurely, okay.
I guess I had I got lung issues and stuff because of that when I was an infant.
Okay. Okay. How about as a child? As a toddler, running around, outside. Were you sick as a young kid? Were you relatively healthy?
I think I was relatively healthy, other than I always had ear infections.
Ear infections?
I remember that. I always had ear infections for the longest time.
Okay. Now, do you have any recollection at all about when puberty started? About what age you were?
Geez, I don't know, 12, 13, somewhere
Okay.
in there.
I know, some of them you seem like, that was 30 years ago, why would I remember that?
Yeah.
Nope, absolutely. We answer them the best we can, right? So some of your social history that goes along with that developmental history, any behavioral or learning problems when you were in school?
No, I'm a pretty decent student. I always had trouble with math, but I wouldn't say it was a learning disability. It was just math wasn't my strong suit.
Okay. Any other problems relating to other kids or anything like that?
No, I always got along pretty good with everybody.
Okay. And how far did you go in school?
I had 2 years of college.
Okay, 2 years of college. When you were growing up, was religion part of your household?
Yes.
Yes? Okay. How about now?
Yeah, it is.
Yeah?
Actually, I go to church every Sunday.
Right. And how do you currently support yourself?
How do I? Well, I'm currently back at my job as a factory worker.
Okay. And what was the longest job you've ever held?
Actually, this I would
job?
say this one. It's been 12 years now.
12 years? Okay. So in the last 5 years, that's the job you had, right?
Mm-hmm.
All right. And so you mentioned you served in the military and that you were stationed overseas in Afghanistan. What rank did you achieve?
I was a sergeant.
Okay. And how long were you in the military for?
10 years.
10 years, all right. And what kind of discharge did you receive?
A honorable
discharge? Okay,
yeah.
excellent.
Finished my contract and said goodbye.
Have you ever been arrested, jailed, imprisoned? No? Okay. Anything you like to do for fun? Any hobbies?
Well, I like to ride horses. I'm kind of an outdoorsy person. I like to hunt, like to fish.
Okay.
Shoot archery.
Okay.
Been having a little trouble with the archery thing because of the shoulder.
The shoulder, yeah. Yep. All right. Now, this one may sound a little funny as well. However, what do you like about yourself?
What do I like about myself? Well, I guess up to this point, I was, I'm not real happy with what's going on with me right now.
Mm-hmm.
But up to this point, I was always, kind of a go-to guy.
Okay.
Just got things done, made sure my family was taken care of, my soldiers were taken care of.
Yep.
So I guess that's why it's kind of bothering me that I seem to be losing control of that.
Okay.
I'm not feeling like I can.
You can be that go-to guy.
Go-to big guy right now.
Okay. What would your friends say they like about you?
Well, I've been. They told me I have a good sense of humor. I'm, somebody that you can count on when you need him.
You can be that go-to guy.
Yeah.
Okay. All right. Another couple of questions. Sometimes people dealing with stress, as you mentioned, have a difficult time concentrating or remembering things. And you said that you too are, feel like you're experiencing some of that. In order to get an idea of the extent as to how much those things are bothering you, I'd like to do a quick test that we call the Mini Mental State Examination, or an MMSE. We're going to ask you a couple of questions, ask you to remember a couple of words for me, copy down a picture, and we'll see where we go, okay? And this is getting it. We're getting close to the end of this portion of the interview, okay?
Give it a shot.
All right. Like I said, some of these questions may seem odd, but just answer to them the best that you can, okay? What is your full name?
My full name is Walden Anson Sabo.
Okay. And what is today's date?
Today is 25 February 2016.
Okay. And about what time it is?
It's about 6:30 at night.
Okay. All right. And where are we right now?
We are in Shirley, Massachusetts.
Okay. Now I'm going to ask you to spell the word world.
Okay.
Just spell the word world. Yep.
WORLD.
Okay. Now, spell the word world backwards for me.
Excuse me. DLROW.
Okay. Excellent. Now I'm going to give you 3 words. I'm going to ask you to repeat after me. Table, dog, pencil.
Table, dog, pencil.
Exactly. So one more time. Table, dog, pencil.
Table, dog, pencil.
Okay. And now, who's the President of the United States?
Barack Obama.
Okay. And the Governor of the state of Massachusetts?
Would be Charlie Baker.
Charlie Baker. Okay. And those 3 words for me, what are they again?
Table, dog, I can't remember what the third is.
Okay, not a problem. Like I said, we just answered honestly, right? Okay. So right here, I have a picture. If you could, just underneath that one, draw what I have drawn. Okay, excellent. And now can you make the hands of that clock point to 3:30? Okay, excellent. Thank you very much. Okay. So, Joe, we're getting to the end of our 30 minutes here. All right. Just wanted to know, I would definitely like to meet again so that we could discuss, everything we talked about today. I just want to let you know what I'm thinking. Okay. It sounds possibly like you have post-traumatic stress or adjustment disorder of some kind. It's also possible that you could have a generalized anxiety disorder, or maybe less likely some anxiety disorder due to some kind of other medical condition. So I'd like us to start to meet, about the same time every week so we could start to discuss, how you're feeling, what's going on, and see if we can come up with a plan, like I said, to see if we can get you feeling better.
Okay.
Does that sound like a good idea?
Sure.
Okay. Well, Joe, thank you very, very much.
Thank
And
you.
we will see you soon.
All right. Thank you.
And that is the end. Thank you for watching.